So, hello, Bill. Thank you for your willingness to let me interview you.
I suffer with cerebral palsy on the right-hand side. On my right arm, I cannot use my fingers at all, and my right elbow will not straighten out. I have had over 40 procedures of NCR, and I believe that I can walk much better. I'm much straighter, and I am better at balancing. I ride a horse, and I do not need to use a back brace anymore.
Tell us a little bit about the medical treatments that you had for your right arm and maybe your leg.
I've had over 20 surgeries in my life. First surgery that I had that I can remember was on my right leg, and that was to lengthen my heel cord. And it worked, and that was probably the best surgery I've ever had.
Mm-hmm.
Most of the other surgeries I had was experimental, trying to move tendons here to see if I could work my fingers or my toes.
Mm-hmm.
None of them worked.
Mm.
I think all they did was give the money to the medical doctor so he could retire earlier.
Uh-oh. Or use you as a guinea pig for some experimental procedure.
Yes.
Oh, that's really unfortunate. And tell us a little bit about your very first experience with NCR.
Well, when I flew back home, people saw me and they said, "Hey, Bill, you're walking a lot better than you were just a few months ago. What happened?"
Wow.
So I thought, there's got to be something to this.
And so that was enough to get you to continue.
Yes. Every time I have a procedure, I try to go and ask my friends, and they say that, Bill, you're standing straighter or you're walking better.
Good. Does it seem to be a progression, though? Like, the more that you do, the better you get?
I honestly feel if I could get more than one a year, I would probably be better off.
Mm-hmm. Right.
But right now, I feel like just be able to go up once a year is better than nothing.
Right. What would you say is the biggest benefit you got from NCR?
I believe it has helped me with my back so it don't hurt as much, and it's given me better balance so I could ride a horse, and that is very important to me.
And you said earlier you used to have to wear a back brace every time you rode the horse?
Yes.
And now you don't need one at all, right?
Right.
Wow, that's amazing. And you ride for many miles, right?
Yes. 12 to 15 every time I go out.
Wow. So you used to always have to wear the brace?
Yes.
And how many series of treatments or how many years do you think it took to get you to that point where you didn't need the brace?
I think I started, after about the 20th one, I started taking the brace off.
Mm-hmm.
And every once in a while when my back would hurt, I'd put it back on. So it took me several years after that.
Oh, you had to kind of wean yourself off of it.
Yes, I did.
Oh, I see.
Because I could not believe it.
Oh, right. You weren't even thinking that that could be possible.
Yes, and I was using it as a crutch.
Do you think that if you hadn't had all the surgeries on your right arm, do you think NCR would have been able to help that?
I think if I did not have all the surgeries on my arm, Dr. Hell said that NCR could have helped your tendons and nerves much more than they have done today.
Mm-hmm. So you think the surgeries compromised the tendons too much, that they were kind of beyond repair?
Yes. Yes.
So if the NCR had been able to get to you before the surgeries, then perhaps, do you think that your movement could have been restored or improved?
Improved.
Mm-hmm.
I don't honestly think it would have restored my movement, but improved.
Right, right. Because that's a big deal to someone who doesn't have normal movement, any little improvement is going to be a big improvement, right?
Right. My understanding, you will never get rid of cerebral palsy no matter what you will do. You can improve your movement.
Right, because so much of it started a lot of times in the womb, so it's how the brain actually developed, right?
Yes.
Do you think that everybody with cerebral palsy should know about NCR?
Yes, I do. And I also think that everyone should look at NCR that does not have cerebral palsy too. Everyone.
Yes, definitely. I'm with you on that one. So as far as my patient Michael, the 12-year-old boy with cerebral palsy, he has a very, very severe case. Do you think that NCR can make him more functional if he gets enough treatment?
Yes, I do. He may never get out of a wheelchair, but I do believe that NCR would make life more functional for him.
Like his movement would improve and his communication skills and his cognitive abilities and just his overall quality of life.
His quality of life would improve.
Yes, exactly.
I wish that more people would know about NCR, and I wish that they would try it instead of saying, oh, that's nice, I'll think about it.
Right.
And I also would love to see someone do NCR in the Boise, Idaho area, so I could have it done more often.
Yeah, that would be great.
Keep in touch with me and tell me about Michael's progress.
Oh, absolutely.
Tell Michael I wish the very best for him.
I will.
And his parents.
I will. Well, anyway, Bill, thanks so much for your time, and I will definitely keep you in the loop as far as Michael's progress and the progress with our fundraiser.